CNA Certification Practice Exam, 50 questions, test. Question 1. The nurse aide is changing a resident's soiled bed linens. Where should the nurse aide place the dirty linens? On the floor next to the bed, on the bedside table, in a leak-proof laundry bag, on the chair in the room. Soiled linens should never be placed on furniture or the floor to prevent the spread of pathogens. A leak-proof bag is the standard for containment. Question 2. Which of the following is the best way to prevent the spreading of germs? Wearing gloves during patient care. Wearing a mask and gloves during patient care. Hand washing before and after patient care. Wearing a gown, mask, and gloves while performing patient care. Hand hygiene is recognized as the single most important practice for preventing the transmission of infections. Question 3. Which of the following is an example of subjective information? The patient's pain level is 7/10. The patient's temperature is 101.2. The patient's respirations are 18 bpm. The patient's blood pressure is 120/80. Subjective information is what the patient says or feels, such as pain. Objective information is measurable data like vital signs. Question 4. The nursing assistant is caring for a patient who is a two-person transfer assist. She plans on using a Hoyer lift because she is in a hurry. If the resident asks for help, what should the assistant say? No, I'm in a rush, you will be okay. Yes, I will get another CNA to help. Your safety comes first. I will be extremely careful and make sure you aren't hurt. I will get help, but you will have to wait a long time. If a care plan specifies a two-person assist, the CNA must never attempt the task alone, regardless of the equipment used. Question 5. A resident on a bowel regimen has not had a bowel movement in 4 days. What is the nursing assistant's next step? Report this to the nurse in charge. Give the patient orange juice with Moralex. Encourage the patient to drink more water. Nothing, this is normal. Lack of bowel movement for 4 days is significant and must be reported to the licensed nurse for medical assessment. Question 6. The aide is caring for a patient on strict dysphagia precautions. What item would the aide question if it arrived on the tray? Regular orange juice, mashed potatoes, oatmeal, applesauce. Thin liquids like regular juice are dangerous for patients with swallowing difficulties, dysphagia, as they can cause aspiration. Question 7. The patient is lying in the supine position. In what position is the patient's bed? The head of the bed is 90 degrees. The head of the bed is flat. The head of the bed is tilted backward 30 degrees. The head of the bed is 45 degrees. Supine refers to the patient lying flat on their back. Question 8. What is one reason why performing postmortem care is essential? There is no need to perform postmortem care. It ensures the staff feel good about themselves. It is legally required in all 50 states. It is important to maintain the dignity and respect of the patient. Care provided after death is focused on showing respect for the deceased and maintaining their dignity for the family. Question 9. How should the nurse aide assist a resident who uses a cane for ambulation? Stand on the same side as the cane. Stand on the patient's weaker side. Stand behind the patient in case they fall. Walk backward in front of the patient. The cane is held on the strong side. The aide stands on the weaker side to provide support and stability. Question 10. A patient asks about their roommate's cancer diagnosis overheard earlier. How should the aide respond? His condition is confidential. I cannot share information. Tell the patient what type of cancer it is. You should ask his nurse what is wrong with him. Ask the roommate's family member about his diagnosis. Patient privacy and HIPAA regulations prohibit staff from sharing one patient's medical information with another. Question 11. A resident is hitting and kicking the two CNAs trying to provide care. What is the next step? Tie the patient's hands to the bed with towels. Yell for the nurse to bring a sedative. One CNA stays safe in the room and the second gets help. Tell the patient they better stop hitting and kicking. Safety is the priority. Staff should move to a safe distance and seek help from a supervisor or nurse. Question 12. Which action is most important when measuring urinary output from a Foley catheter? Hold the drainage bag above the level of the bladder. Wear gloves and clean the drainage tube after use. Place the measuring container on the floor under the bed. Rinse the container with cold water before use. Using gloves and cleaning the equipment prevents the transmission of germs and reduces the risk of UTI. Question 13. A client's blood pressure is 200/180, but they appear stable. What should the CNA do next? Ensure the blood pressure cuff size is correct and repeat. Document the blood pressure and finish other vitals. Immediately notify the nursing supervisor. Tell the client you will notify the doctor. An unusually high reading in a stable patient may be an error. Verifying cuff size and repeating the test is the first logical step. Question 14. The CNA witnesses a resident screaming at a coworker. What should the aide do next? Yell at the resident to stop. Call the charge nurse. Apply restraints. Nothing, it is not your problem. Behavioral issues or abuse of staff must be reported to the charge nurse for appropriate management. Question 15. CNA knows that eliminating wrinkles in the sheets helps to prevent pressure sores. Ensure the client is warm. Minimize the need to remake the bed. Provide improved hygiene. Wrinkles create friction and uneven pressure against the skin, which can lead to skin breakdown and pressure ulcers. Question 16. Which of the following happens when a patient has a stroke? The patient urinates themselves. The patient may foam at the mouth. The patient may roll their eyes back. The patient may have drooping of one side of the face. Facial drooping, hemiplegia, is a hallmark sign of a stroke, CVA. Question 17. Which task is correct foot care for a diabetic patient? Giving a heating pad for feet. Soaking dry feet in a warm tub daily. Keeping feet dry and warm with dry, clean socks. Ensuring toenails are always clipped short. Diabetic patients have poor circulation. Dry, clean socks prevent infection. CNAs should never clip diabetic toenails or use heat. Question 18. Which change associated with a UTI in the elderly would the CNA report to the nurse? Increased thirst, sudden confusion, low back pain, darker urine. Elderly patients often do not show typical UTI symptoms. Sudden confusion or mental status changes are primary indicators. Question 19. A diabetic patient only finished 25% of his meal. What should you do? Report this to the nurse in charge. Nothing, the patient may not be hungry. Tell the patient they must eat more. Chart the patient ate 25%. Poor intake in a diabetic can lead to life-threatening hypoglycemia, low blood sugar. The nurse must be notified immediately. Question 20. Which amount of urine emptied after a 12-hour shift should be reported immediately? 1000 ml, 600 ml, 2100 ml, 350 ml. 350 ml in 12 hours is less than 30 ml per hour, which indicates potential kidney failure or severe dehydration. Question 21. Which represents the correct selection of size for a blood pressure cuff? Width is approximately 95% of arm circumference. Width is approximately 25% of arm circumference. Width is approximately 40% of arm circumference. Width is approximately 10% of arm circumference. A cuff that is too small or too large gives inaccurate results. 40% of circumference is the medical standard. Question 22. A resident refuses to eat vegetables. The CNA should sit with them until they eat. Have dietary increase the portion. Notify the nurse for a nutritional evaluation. Hold all desserts. Persistent refusal of a food group requires a nutritional assessment by a nurse or dietitian. Question 23. Resident is sleeping more, lacks interest in hobbies, and has withdrawn. This is a sign of anger, depression, frustration with staff, Alzheimer's disease. Withdrawal and loss of interest in activities are classic symptoms of clinical depression. Question 24. Which of the following interventions should the CNA use to promote skin integrity? Pad bony prominences when in bed. Leave TED's stockings on during the night. Provide additional blankets. Slide the client up to reposition them. Padding bony areas, heels, elbows, tailbone, reduces the direct pressure that causes sores. Question 25. The care plan indicates a client should be repositioned every 2 hours to increase client comfort, provide the opportunity to check in, decrease fall risk, prevent skin breakdown. Frequent turning is essential to prevent the prolonged pressure that causes tissue death and skin breakdown. Question 26. Which route is the most accurate way to retrieve a temperature on an infant? Orally, rectally, temporally, axillary. Rectal temperature is considered the most accurate representation of core body temperature in infants. Question 27. If asked to sign a resident's will, the CNA should agree but refuse any compensation, decline and notify the nurse, arrange for case management to assist, tell the resident it must be a family member. Legal documents create a conflict of interest. CNAs must decline and refer the matter to their supervisor. Question 28. Contact precautions include which of the following? Mask, gown, gloves, gloves, gown, mask, gown, gloves, face shield, mask, gown, gloves, shoe covers. Contact precautions, for skin-to-skin or surface contact, typically require a gown and gloves. Question 29. The resident is unable to stand. How should the nurse aide measure their height? Estimate the height. Use a tape measure to measure length in the bed. Wait until they can stand. Ask the family for last year's height. Bedbound patients are measured from the top of the head to the base of the heels using a tape measure while supine. Question 30. What is the best way to ensure the Foley catheter is not pulled out during turning? Ensure that the catheter is secured to the inner thigh. Hang the Foley bag on the bed frame. Tell the patient to hold the bag. Tape the Foley catheter to the outer thigh. Catheter straps or tape to the inner thigh provide slack to prevent accidental removal or trauma to the urethra. Question 31. The patient who is bedbound is at risk for which of the following? Dysphagia, polydipsia, atrophy, neck paralysis. Lack of muscle use in bedbound patients leads to muscle wasting, known as atrophy. Question 32. The CNA found unlabeled pills on the resident's nightstand. What is the CNA's next step? Provide water and insist they take them. Discard them. Leave them alone. Notify the nurse immediately. CNAs cannot identify or administer medications. Unlabeled pills are a safety risk and must be handled by the nurse. Question 33. A resident is acting out and having behavioral disturbances. What should the CNA do first? Tell the family to move them. Provide for patient and staff safety. Isolate the resident. Call the police. During an acute behavioral episode, the first priority is ensuring nobody is physically harmed. Question 34. Which action by the nurse aide best supports the resident's right to privacy? Leaving the room door open, closing the door and pulling the privacy curtain, telling the roommate to leave, explaining the procedure in a loud voice. Privacy involves both physical visual barriers, curtains/doors, and maintaining a quiet, respectful environment. Question 35. At what rate should CPR compressions be performed for an adult? 100 to 120 per minute, 60 to 100 per minute, 80 to 120 per minute, 120 to 160 per minute. Current AHA standards require a compression rate of 100 to 120 beats per minute. Question 36. What is the proper measurement for measuring bodily fluids? Ounces, liters, milliliters, fluid ounces. Milliliters, ml, or cubic centimeters, cc, are the standard metric units for intake and output. Question 37. A resident wants a copy of their medical records. The CNA should make a copy and give it to them. Inform them that copies cannot be given. Notify the resident's family. Provide record release forms and advise the supervisor. Residents have a right to their records, but there is a formal process that must be overseen by administration. Question 38. CNA witnesses a nurse giving milk to a patient with a known milk allergy. What is the action? Nothing, it is not your concern. Report this to the nursing supervisor. Yell loudly for the nurse to stop. Tell the patient you are sorry. Staff must report unsafe practices or neglect to a supervisor to ensure patient safety. Question 39. Which is the best way to take an apical pulse? Right of sternum, under clavicle. On the back at 5th intercostal. Right of sternum at 5th intercostal. Left of sternum at 5th intercostal midclavicular. The apical pulse is heard at the apex of the heart, located at the 5th intercostal space, left midclavicular line. Question 40. Two unmarried residents are cuddling in the common area. The CNA should separate them, escort them to a private room, notify their families, allow them to enjoy each other's company. Residents have a right to consensual social and romantic interaction as long as it is not disruptive. Question 41. Resident says she cannot eat her tray because of her religious beliefs. Next step. Tell her the kitchen is closed. Tell her to call family for food. Take the tray out and contact the nurse to get a proper tray. Tell her to call for pizza. The facility is responsible for accommodating religious dietary requirements. Question 42. Which should be included in the plan of care for a stroke patient on swallowing precautions? Client should not be left unattended when eating. Give the client the regular menu. Tip head back as they swallow. No additional precautions needed. Aspiration can happen silently. A staff member must be present to monitor for choking or distress. Question 43. Which should be included when beginning to reposition a patient higher in the bed? Lower the bed to the lowest position. Raise the head of the bed. Lower the head of the bed. Grasp under the arms and pull. The head of the bed should be flat, lowered, to allow gravity to assist and prevent injury to the patient's neck/spine. Question 44. What is necessary for patients with stress incontinence? A Foley catheter, frequent toileting breaks, less fluids, diuretics. Toileting every 2 hours helps keep the bladder empty and prevents accidental leakage during physical stress, coughing/sneezing. Question 45. A resident has a pornographic magazine. The CNA should discard it. Ask them to keep it in their room. Take it to a supervisor. Encourage them to watch videos online. Adult residents have a right to possess personal materials, provided they do not infringe on the rights of others in common areas. Question 46. What is the correct depth per compression for adult CPR? 1 inch, 2 inches, 1.5 to 2.5 inches, 2.5 to 5 inches. For an adult, the chest must be compressed to a depth of at least 2 inches to effectively circulate blood. Question 47. What is the best way to respect a fully alert client's independence? Suggest legal counsel. Actively listen to the resident. Ask them to speak with the social worker. Encourage them to listen to family. Respecting independence starts with listening to the patient's own goals and choices without inserting personal bias. Question 48. A resident is sweating, feels dizzy, and appears anxious. What is the first step? Call for the nurse immediately and stay with the resident. Offer a glass of water. Help them brush their teeth. Leave the room to find a monitor. These are signs of a medical emergency, example, hypoglycemia or heart attack. Never leave an unstable patient alone. Question 49. A coworker asks for help lifting a fallen resident without explaining the fall. The best action: help lift them back into bed. Ask the resident if they are in pain first. Stay with the resident and tell the coworker to get the nurse. Wait until they are in bed to report it. A resident who has fallen must be assessed for injury by a nurse before being moved to prevent further harm. Question 50. A resident has not had a shower in 3 days and refuses one today. Response: tell him you will get in trouble. Call his daughter. Gently force him. Explain it is his right to refuse and try again tomorrow. Residents have the legal right to refuse treatment or care. The CNA should document the refusal and offer again later. Question 51. Community volunteering and hobbies provide the elderly with a sense of purpose, respect for privacy, a feeling of being younger, depression prevention. Meaningful activities are essential for mental health and a sense of value in the elderly. Question 52. A pulse oximeter is a medical device used to measure CO2 in blood, percentage of oxygen, O2, in the blood, depth of respirations, arterial pressure. A pulse ox measures oxygen saturation, how much oxygen the red blood cells are carrying. Question 53. Which task is appropriate for a patient receiving end-of-life care? Strength exercises, providing optimal comfort to patient and family, activities to prevent forgetfulness, keeping a strict meal schedule. Hospice/end-of-life care is focused on comfort, palliative care, rather than rehabilitation or strict routines. Question 54. A patient has multiple bruises in different stages of healing. What is the next step? Call the abuse hotline. Report your findings to the nurse. Report to the police. Report to the family. The CNA's legal responsibility is to report clinical findings of suspected abuse to their direct supervisor, the nurse. Question 55. A resident's room is sloppy and is a safety hazard. The CNA should clean it while they are away. Insist things are thrown away. Help them relocate items to remove hazards. Notify the POA. Staff must balance the resident's right to their possessions with the need for a safe, trip-free environment. Question 56. Confusion and wandering at night can be managed by a belt restraint, a linen cart barricade, sleeping pills, getting a sitter. Restraints and barricades are illegal and dangerous. A sitter provides safety and reorientation. Question 57. Call lights in reach and fall prevention devices meet which emotional need? Quality time, sense of purpose, safety and security, privacy. Knowing that help is available and the environment is safe provides the resident with peace of mind. Question 58. Another aide enters the room without knocking during perineal care. Best response: please be sure to knock next time. Say nothing. You should have knocked first. She is always rude like this. The CNA must advocate for the patient's privacy in a professional, non-confrontational manner. Question 59. At what rate should 2 rescuer adult CPR be performed? 100:1, 30:2, 15:2, 45:1. The compression-to-breath ratio for adult CPR is 30:2, regardless of whether there is 1 or 2 rescuers. Question 60. Which of the following activities can be completed by a nurse aide? Administering 4 medication, dressing a wound, assisting with bathing, assess mental status. Personal hygiene and ADLS are the primary scope of practice for a CNA. Wound care and assessment require a license.